Okay, so, we always appreciate getting those sort recommendations from you. And this time, you sent over this policy brief. It's from the WHO European region, and it's all about how we govern health data in this, like this age of AI.
Hmm.
So, I think today we really want to get into that and like kind of
Yeah.
pull out like the biggest takeaways and, see what we can learn about like how different countries are trying to, manage and, protect all of this health data that we have, particularly now that AI is becoming such a huge player.
Yeah, um, it's fascinating, isn't it? Because we've got this real tension now between the immense potential that we've got with health data and AI, and the absolute need for appropriate safeguards and management
Mhm.
systems, to make sure that everything's done ethically and properly. So it's really interesting to see how different countries are approaching this.
So right off the bat, the brief really stresses that effective health data governance isn't just, a nice to have. It's really like a fundamental requirement.
Yeah.
Um, why is that so important? And are there any like kind of unexpected consequences when it's not done well?
Well, I think that the fundamental point is that, it really is the foundation upon which we can build trust,
Yeah.
in these digitally enabled health systems that we are increasingly reliant on.
Yeah.
And, that strong governance ensures that data can be shared, appropriately. It can flow between different systems. It helps to ensure the quality of the data,
Mm-hmm.
and ultimately leads to better decision making
Right.
and, hopefully better health outcomes for everybody.
So it's making sure that the right information gets to the right people at the right time.
Precisely. Yeah.
And obviously this becomes like, doubly important when we're talking about AI and machine learning and healthcare.
Absolutely. And I think that's where, the whole issue of data quality really comes to the fore, because AI is really data hungry.
Yeah.
The algorithms that underpin a lot of these tools,
Yeah.
need huge quantities of high quality data to train them and to enable them to make accurate predictions. So, health data governance is absolutely crucial to ensuring that the data that we use to train these AI tools is representative, that it's unbiased,
Mhm.
and that it's well managed.
Now, the policy brief points to this 2022 WHO survey that gives us, kind of a glimpse of the current state of play in the European region.
Yeah.
What were some of the kind of standout trends that we saw in that data, and maybe even some surprising findings?
Well, the first thing that struck me is that, the survey had incredibly high participation rates. I think something like 98% of member states in the WHO European region responded. So
Right.
that's a very encouraging sign. And one of the really positive trends that emerged was that 73% of countries had actually allocated special funding for digital health infrastructure during the COVID-19 pandemic. So,
Interesting.
that really shows
Yeah.
that countries rapidly prioritize this and recognize its importance.
Yeah, for sure. I mean, that's a pretty clear indicator that digital health was, front and center during that time.
Absolutely, yeah.
And there was also some progress in terms of, giving people access to their own health information, right? What did the survey say about that?
Yeah, it did, and that's another really encouraging finding. I think 86% of member states now have legislation in place that allows patients to access their own health data. And I think this is really important because it signals a fundamental shift, really, towards empowering individuals, and it
Hmm.
it really, gives them much more transparency and
Hmm.
control over their own, healthcare journey. So that's a very positive development.
Yeah, I mean, those are some really good signs that things are moving in the right direction. But I imagine there are still some pretty big challenges that countries are, wrestling with. What did the brief highlight as some of the main roadblocks?
Yeah, well, I think, despite the progress that we've seen there are certainly some ongoing difficulties. And one of the big ones that was highlighted was data interoperability.
Mm.
Uh, and this is really about getting, different systems to talk to each other, to be able to exchange data in a seamless and secure manner. And I think, if systems can't communicate effectively, then, the value of that data is significantly reduced. Right. So that's one of the big challenges. And the other one that was highlighted was around the adoption of common data standards.
Mm. Okay.
So, these standards are really essential to ensure that, data can be interpreted and used in a consistent way across different systems. And the final challenge that was mentioned was around stakeholder engagement,
Mm.
really making sure that all of the relevant stakeholders are involved
Right.
in the process of developing these governance frameworks.
And I imagine that the types and the sheer volume of data that we're now dealing with in healthcare is, adding to all of this complexity as well. I mean, it's not just, simple medical records anymore.
That's exactly right. We're now seeing this just explosion of data coming from all sorts of sources.
Yeah.
You've got electronic health records, wearables, social media, all sorts of digital health technologies. We're generating vast quantities of data.
Yeah.
And this really presents incredible opportunities for analysis and insight, but it also brings with it some, new challenges in terms of managing that data ethically and responsibly.
So countries are really having to figure out how to manage this increasingly diverse and ever growing pool of data while also respecting individual rights and making sure that the data is secure.
Absolutely. And I think that's where, the development of robust legal frameworks that carefully balance the need for data sharing for the greater good, for research for public health purposes, with the need to protect individual privacy. That's a really crucial area.
And then, of course, the COVID-19 pandemic, really put a spotlight on all of this, didn't it? I mean, the brief talks about how it both, highlighted the strengths of existing data governance systems, but also revealed, some pretty significant weaknesses.
Yeah, I think that's a really interesting observation. And you're absolutely right. I mean, the pandemic really did expose those strengths and weaknesses.
Yep.
On the one hand, we saw that countries that had well-established data governance frameworks were able to leverage that data to really good effect. They were able to monitor infection rates in real time, to make informed decisions about resource allocation, and to respond, much more efficiently and effectively to the evolving crisis.
Right. But on the flip
On
side,
the flip side, yeah, we also saw that, in many regions where progress had been slower on the digital health front, that there were some pretty significant vulnerabilities exposed, and it really emphasized the urgent need for, sustained investment in digital infrastructure across the board to build resilience.
so given all of these findings, the WHO policy brief lays out, several urgent actions that it recommends for policymakers. So let's dig into those. The first one is to further strengthen national health data governance. What does that actually look like in practice?
Well, I think it's about, actively improving the mechanisms that are in place to guide investment in digital health infrastructure. And it's about ensuring the quality and the accuracy of the data that's being collected.
Yeah.
And then it's also about establishing, clear legal and ethical guidelines for the use of that data.
Yeah.
So the overarching goals are really to improve healthcare quality, to support the responsible integration of AI, and to build public trust in the way that their health data is being handled.
Okay, makes sense. The second recommendation is about developing what they call a robust ecosystem of health data standards. So why are these standards so crucial?
Well, this really gets to the heart of the interoperability challenge that we were discussing earlier. So, imagine if every hospital in a country was using its own separate coding system for diagnoses and treatments and procedures.
Yeah.
That's the essence of the interoperability problem. It's like everyone's speaking a different language.
Yeah.
So developing national standards for recording and exchanging health data, it's like, agreeing on a common language. It allows those different systems to understand each other.
Right.
And to exchange information seamlessly and securely. And that's really what we need to strive for.
Okay. And then the third recommendation is all about coordination. The brief talks about the need to, develop mechanisms to coordinate different national data providers. What's the thinking behind that?
Well, I think the rationale here is that, you've got all these different organizations within a country that are involved in collecting and managing health data. You've got hospitals, clinics, public health agencies, research institutions. And if all of these entities are operating in silos, then you end up with a very fragmented and potentially inconsistent picture of the nation's health. So establishing effective coordination mechanisms can really help to ensure that there's a more complete and reliable picture of what's going on.
Yeah.
And that's really essential for making informed policy decisions.
Okay. So we've got strengthen governance, develop standards, improve coordination, and then the final urgent action that's highlighted is all about involving people. The brief stresses the importance of engaging patients, healthcare providers, and other key stakeholders. Why is that participation so crucial?
I think it's really fundamentally important because, health data governance is not something that can be designed effectively in a vacuum.
Right.
It needs to be a truly collaborative effort.
Yeah.
To build trust and to ensure that these frameworks are practical and widely accepted. We have to involve the people who are going to be most directly affected by them. So that's patients whose data we're talking about,
Hmm.
and it's also healthcare professionals who are using that data in their daily work. So inclusive governance processes are really important for fostering a sense of ownership, and they can lead to much more effective and trustworthy systems.
So it sounds like these four actions, strengthening governance, developing standards, improving coordination, and engaging stakeholders, they really form like a comprehensive roadmap
Yeah.
for improving health data management.
I think that's a really good way of putting it. Yeah.
And then the brief also touches on some of the kind of the fundamental principles that underpin any successful health data governance framework. So what are some of those absolute must-haves?
Well, I think the very first and most important one is that any effective framework must clearly define the conditions under which health data can be collected, used, and reused.
Okay.
So it's setting out really clear parameters around what's permissible and what's not
Mhm.
permissible, and that leads us on to the second really crucial point, which is the need to balance an individual's right to privacy with the potential for that data to generate broader public health benefits.
Right. So yeah, that constant balancing act that we keep coming back to between, individual rights and the greater good.
That's the real challenge, I think, and then we have the issue of interoperability
Hmm.
we've already talked about.
Yeah.
The need to be able to share data seamlessly and securely across different health systems, and without that, we can't unlock the full potential of the data.
Yeah.
And then finally, ensuring the security and the integrity of the data, that's absolutely paramount.
Right.
And this requires transparent governance, clear lines of accountability, and ongoing engagement with all stakeholders.
And all of this, the brief emphasizes, it should ultimately support ongoing innovation in digital health, including the responsible development, application of AI.
Yeah, I think that's a really important point that, it's about creating this environment where we can utilize data responsibly
Right.
to drive improvements in healthcare and to do so in a way that aligns with, our broader health strategies.
Now let's kind of zoom in on AI specifically for a bit because the brief, talks a lot about the role of data governance in the context of, the adoption of AI in healthcare.
Hmm.
So what are some of the key policy considerations there?
Well, the brief really underscores the fact that investing in robust health data governance is not just about better data management. It's actually a foundational requirement for improving the quality of care that we deliver
Mm.
and for facilitating the development of safe and effective AI tools and ultimately for building public confidence in these technologies.
Because I mean, at the end of the day, as the brief makes clear, AI models are only as good as the data that they're trained on, right?
Absolutely. And that's why, the quality of the data is so important.
Hmm.
If we use poorly managed or incomplete data to train AI algorithms, then that can lead to inaccurate predictions.
Right.
And it can actually undermine, the potential benefits that these technologies offer. So we really need to get the foundations right.
Yeah. So what are some of the ways that we can make sure that the data that we're using to train AI is fit for purpose, is of high enough quality?
Well, I think the brief highlights, a few things that governments can do to try to facilitate this.
Mhm.
And one of them is around the aggregation and linking of data from different sources. So, pulling together data from different health and social care systems,
Mhm.
and then making that data accessible to accredited researchers in secure environments so that valuable analysis can be conducted.
Okay.
And that's really about creating these high quality data repositories that
Mhm.
could really drive the development of robust and reliable AI tools.
The brief also mentions the specific situation in Europe,
Mhm.
talking about the European health data space and then some of the relevant legislation there. So what's the EU doing in terms of managing, health data and AI?
Yeah, well, data governance is really a core pillar of the European health data space,
Oh.
or the EHDS as it's often known. And the EU has been very active in developing this comprehensive legal framework to promote responsible data governance
Hmm.
and to foster the development of high quality and privacy compliant AI systems.
Okay. And that framework includes some specific pieces of legislation, right, that are worth highlighting.
It does, yeah. One of them that the brief mentions is the EU Data Governance Act.
Yeah.
And this is really aimed at boosting data sharing
Mm-hmm.
by establishing very clear rules and mechanisms that that enhance trust and transparency in the way the data is handled. And then we've also got Article 10 of the EU Artificial Intelligence Act.
Hmm.
And this sets out some specific requirements for the quality and management of the data that's used to train high-risk AI applications.
And then finally, there's the regulation on the EHDS itself, which plays a pretty significant role in all of this as well.
Yeah, it does. It really sort of strengthens this secure, standardized, and interoperable exchange of health data
Mhm.
across EU member states.
Mm.
And it also aims to facilitate the ethical reuse of this data for research and innovation.
Mm.
So it's really a multifaceted approach
Yeah.
to building this really strong governance framework for health data and AI.
It sounds like a pretty ambitious undertaking. The brief also, touches briefly on some of the more, practical aspects, the implementation considerations. What are some of the things that we need to keep in mind when we're actually trying to put these data governance frameworks into practice?
I think one of the key things to remember is that implementing effective data governance requires significant investment in a number of areas. So we've got to invest in the technical infrastructure
Hmm.
that's needed to securely store and manage these vast quantities of data. And we also need to invest in building a skilled workforce
Right.
that can handle these really quite complex issues. And then robust regulatory oversight is really important as well to ensure compliance and to build public confidence.
So it's not just about having, the right policies written down on paper. We need to make sure that we've got the capacity and the resources to actually make them a reality.
Precisely.
Yeah.
Yeah, and I think the brief also really underscores the importance of collaboration and partnership.
Yeah.
Governments can't do this alone.
Yeah.
They need to be working very closely with international organizations, with healthcare providers, with the technology sector, and most importantly, with patients themselves.
And of course, inevitably there are going to be, challenges and obstacles along the way, right?
Absolutely. I mean, the brief acknowledges, that there will be regulatory hurdles to overcome.
Yeah.
There may be some outdated legal frameworks that need to be updated.
Mhm.
There may be technological challenges, incompatible IT systems and so on. And then there are always going to be public concerns about data privacy and security that need to be addressed.
Yeah.
So we need to make sure that, we have strong data protection measures in place, that we've got clear processes for obtaining consent, and that we're communicating transparently with the public about, how their data is being used.
Well, this has been a really, fascinating and illuminating deep dive, I think, into this really, complex and important topic. So to kind of bring it all together, what would you say is the absolute most crucial takeaway from our conversation today?
I think the central message is that effective health data governance isn't just a technical detail.
Yeah.
It really is a fundamental prerequisite for realizing the potential of digital health and AI,
Hmm.
and for doing so in a way that benefits everyone and that maintains public trust.
Yeah.
It's the foundation upon which we can build, a modern and trustworthy healthcare system.
And the WHO brief is very clear that this is, an urgent issue. Countries need to be prioritizing this now.
Absolutely.
Yeah.
The rapid pace of technological development in AI and the increasing interconnectedness of global health really demands, proactive and robust action right now.
So here's a final thought for you, our listener. Given this increasing interconnectedness and the speed at which AI is evolving, how can we as individuals and as nations collectively ensure that health data governance, remains adaptable and ethically sound in the years to come? It's a really, it's a huge question to consider, as this whole landscape continues to transform at such a rapid pace. So thanks for joining us for this deep dive.
Thanks for having me.
And we'll see you next time.